So it's probably the most important thing. And even with high blood pressure too, is the insulin. And we're basically pretty much everyone is insulin resistant. We're running on stress or high cortisol. That's going to pump up the
Uh-huh.
glucose. We've been given bad diet advice, that we think is good. And then the glucose goes up and then the insulin follows, right? Because the body wants
Right.
glucose in balance. But what does insulin do? It makes us store fat. So if you're getting a belly, you're getting chubby, and then we know that's not good for our cardiac health, right? Insulin does. It's going to cause inflammation. So we can see how that could cause high blood pressure and cardiovascular damage, right? It's going to do fluid retention, right? Which is going
Mm.
to raise the blood pressure and cause vascular damage. So it does all of these things. It's also going to interrupt sleep. Poor sleep causes oxidative damage, damages the blood vessels, right? And even if you're not working on cardiac, if you're working on anything, you need to work on the insulin and the glucose, or you're not gonna make the distance.
Welcome to Hormone Heroes, where I share testimonials from real people who have experienced bioidentical hormone therapy. Men and women share the symptoms they have experienced and the difference proper hormone replacement has made. I'm your host, Dr. Kelly Hopkins, and I have been in the functional medicine space for over 30 years, with a focus on hormones for 20 years. Please keep in mind this podcast is for educational and entertainment purposes only. Please consult with your physician or practitioner for medical advice. Let's get started with today's guest.
Hello and welcome to the podcast. Today I'm very excited. We have Dr. Melanie Icard with us today. She is a naturopath and a regenerative physician. She specializes in cardiovascular health and has been in practice 13 years or so. And she splits her time between the wonderful state of Florida and the wonderful state of Arizona. She has an office, a brick and mortar office in Scottsdale, but she's also available virtually nationwide. So welcome, Melanie.
Thank you for having me.
Well, tell us a little bit about your journey, how you got to
Yeah.
where you are.
It was a combination of factors. My mom, unfortunately, she got cancer as a young woman. She died at 33 from breast cancer.
Oh,
And
goodness.
yeah, and so that was significant, right? Because I saw her dying. I would go with her to all of her appointments because she had a baby, so I had to help her with the baby. And it just seemed like she just got sicker. Like we were going to all these appointments, and every time she just got sicker. I'm a kid, I don't know anything, but I'm like, shouldn't she be getting better from doing all these
Right.
appointments, right? And unfortunately, she didn't make it, and then that kind of split up the family. And then when I got pregnant with my son, I always thought I was going to die. Like, I always thought I was going to die young of breast cancer. Like, it was like, I already had
Yeah.
this story running. And I thought, well, I would really hate for this kid to not have a mom because that was kind of rough for me. And so then I looked over at my dad, who had always been like a bit of a health nut. Like, I didn't really know what he was doing over there. I think he's on to something. I better go ask him. And so I said, hey, like, but I really need to know how to be healthy because I don't want my kid to not have a mom. And so that's what started this holistic lifestyle process. Because what you put in your body and what's in your environment, like it would affect you. And so I was like, I'm going to go ask him. And I think he was pretty happy when that happened.
Oh, I'm sure. So what were you doing up to this point for work?
Yeah, and then my dad introduced me to his naturopath. And so I would go and visit her, and she was an elder. It was probably the second graduating class of the naturopathic medical school. Like she was like
Wow.
old in the game. And so she was really wise, and she told me to go and see the discovery day with my dad. And so
Uh-huh.
me and my dad went, and we were just like, oh yeah, this is totally what I should be doing. And so I just figured out how to do it.
So you go through school and then how do you get so fired up about cardiovascular health?
I didn't plan on it at all. I thought I was going to treat cancer, right? Because my mom died of cancer, and I made best friends with the cancer doc, and I got in there on her shift. and hated it, right? And everybody was all excited about prolotherapy, which is like a regenerative injection therapy. And so I said, I'm going to go find out why everyone's excited about this. And there was a big convention in Las Vegas. And it wasn't
Huh?
just about the injections, it was about all the regenerative medicine. And I saw that it was the stories were amazing. And then they would break into these hands-on groups and like dozens of stations. I didn't know where to go, but this one doctor I was trying to get mentor me. She said, come with me. This guy's really cool. So I said, okay, let's go over there. And the guy goes, oh, I love treating C-section scars. Who's got a C-section scar? And I was like, me? And so then I was so embarrassed because I had to be in my underwear in front of these people I didn't know.
Right.
My C-section scar, but it was cool because he told me that energy gets stuck in scars and memories. And so when he starts injecting it, I might have flashbacks and I might start crying. And then he told me that my scar never healed because it was big and pink on the ends and it should be a little white line.
Uh,
And then he told me I also had adhesions of scar tissue from down in the lower abdomen to up to my ribs on my sternum. And so then he starts injecting me and I totally remember I get a flashback like instantly I'm at the hospital and how weird and scary it was. And then, you know, he is crying and then he wraps it up, go back to my hotel room and in the morning it wasn't big and pink on the sides anymore. The scar was like one white line and that's when I was like, "Oh wow, this stuff is real." And
uh-huh.
I had inflammation all the way up to my ribs. So that was like a big neuron to neuron connection for me.
Uh-huh.
Just went after like regenerative medicine because I'm like, this is healing things for real efficiently
Right.
without drugs, without surgery. And so then it was like looking for the mentors and the workshops and everything. And that's kind of what led me down to have the skills and the knowledge to create this protocol, the Biohacked Heart Blueprint.
Yeah. So you're the founder of Biohacked Heart Protocol Blueprint. And so tell us, just walk us through the nitty gritty of that.
Yeah. And so that protocol was born for a specific patient. So it was after I had actually gotten pre-diabetic. I had stressed myself into becoming pre-diabetic. I wasn't, I wasn't like a pastitarian. I was eating whole foods, I was exercising, I was meditating, I was ice bath. I was doing everything. Like all my clients tell me,
Right.
doing
Yeah.
everything. So and then I waited to do my labs, right? Because I was busy.
Uh-huh.
And then I did them and I found out I was pre-diabetic and I got pissed off, right? I'm like, oh
Wow.
hell
Yeah.
yeah. Yeah. And so then I had to do a deep dive on that and I knew that I was taking on too much. I knew I had too much on my plate. So part of it on top of the metabolic deep dive was I had to figure out how to turn down my cortisol, right?
Right.
Because
Right.
literally it's like, okay, well, like if I want to blame somebody, I know who to blame. It's right here. It's me.
Uh-huh.
And so I had to figure out how to stop burning the candles at both ends. And then I did a deep dive because I wasn't about to stay pre-diabetic or advance to diabetes, right? And so I did that for myself. Then I started looking at all of my clients and I found everybody is a metabolic mess, pretty much across the board.
Absolutely. Yes.
Yeah. Then this guy comes in that would show up once a year. He never liked to do anything, but he just, maybe mini health kick once a year. And he was pissed. I like this pissed off energy because it makes us take action, right?
Right.
He was
Right.
pissed because they told him he had to put stents in his heart. And then lucky for us, he has a really strong personality because that's scary, right? If someone tells you you have
Yeah.
a stent in your heart, like most people would just, okay. He said,
Right.
no, thank you.
Yeah.
Like I'm not feeling it. Give me 2 months. And they said, okay. Cause he wasn't a hot mess. Right. And so he came to me and he said, look, and he's saying same thing like I did with my dad. I know I never listened to you, but I'm serious right now. And I don't want to have those stents. I've got 2 months. What do you got for me? It was
Wow.
one of those moments where I was really present with him and it just kind of came in. Right.
Uh-huh.
We're going to do this and this and this and this and this in this order. And this is how we're going to make it fit into the 2 months time period. And he did it. And I was shocked that he got excused from needing the stents, like that his plaque had gone down enough for them to go, yeah, don't worry about it, buddy. And so that's how it was born. And the main components were detox, disinflame, and then of course, glucose and insulin, which is missed a lot in this kind
Uh,
of right? Which is probably the key driver is the insulin. And we do calcium balancing therapy because the calcium gets in the arteries, right? Making them stiff and kind of stuff like that. And then we do
Uh-huh.
some heavy lifting IVs that seem to synergistically with the lifestyle changes just make plaque go down efficiently in a short period of time.
Oh, that's incredible. You could change the face of cardiology if people would just do the work of this.
Yeah.
And so let's just break those down just a minute. When you say detox, give us some examples of what someone might need to detox.
Okay. Well, first, I give everyone an herbal detox kit that we have formulated because it's so easy and it's all wins, right? Because I
Uh-huh.
can't just tell everybody, hi, give me a bunch of money and get off all your favorite foods and your coffee and your cocktails. They're gonna be like, I
Right.
hate you, right?
Right, right.
So I give them the
Yeah.
herbal detox because then they go, wow, my energy's good. Oh, wow, I'm having really good bowel movements. Hey, my inflammation's down. Hey, my blood pressure's better. My blood sugar is better. And it's just win, 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 win because we're getting all those emunctory detox pathways moving and we're getting them disinflamed. And then I say, here's the list.
Uh-huh.
Here's the list. Nobody likes the list, right? There's at least 1 or 5 things that you need to take out for 2 weeks, right?
Right.
And I just need 2 weeks. And most people are pissed off about it. So I have them look at the list while they're feeling good on the detox and have a come to Jesus with it. And then put it
Uh-huh.
on the calendar like you're going to quit smoking. Okay, next Friday. So if you got
Right,
a
right.
happy hour in the Italian restaurant or whatever it is, so you feel ready to take that stuff out, that's my process. And it seems to work with people mentally, right? Because
Yeah.
we got to get them on board. And so it's coffee, but not even just coffee, because now there's all that other stuff these days, caffeine drinks, whatever.
Right.
We need to get off those for 2 weeks. Dairy, pork, peanuts, wheat, obviously processed foods and sugar. I'm sure I'm missing a few, but those are the main: corn, oatmeal, white potatoes. Uh,
Yeah.
that's pretty much it. Everyone's upset at least about one of them, alcohol. Although I prefer if I could wave a magic wand that none of my clients drink alcohol. So I do get that most of the time, Yeah, because it just inflames them and like bogs down the system and then throws off this metabolism that's already off. But obviously
Yeah.
people where they're at. Like if you're drinking, 5 drinks a day, I'm not going to make you go to 0.
Right,
You
right.
you have to be willing to wean off of these things because if you're serious and you want to get down your plaque or get rid of your high blood pressure, you have to show up. And I think that's why the system is the way it is, because they think that we're lazy and we just go, okay, just give me one pill and fix this problem for me. But what I found is that people that come to work with me and they show up, if they even just give me a 7 out of 10, they get results. And then
Right.
they learn what they need to do so they keep the results.
Oh, that's fantastic. So, Dr. Icard, do you have them do blood work or what's your process?
Yeah, I have a holistic lab panel I do because I find that conventional labs are really lacking a lot of stuff. And then it's really LDL and HDL focused, which of a distraction. But there's a lot of stuff that does matter, especially fasting insulin, inflammation markers, homocysteine. Like, why are we not checking that on everybody? That's crazy.
Right.
And then
Right.
those little stickier cholesterols that we probably do care about instead of just focusing on LDL. I do some genetic tests because there's
Uh-huh.
few things that are pretty common and that you can just do some adjustments and really help people with either their plaque or their high blood pressure.
Yes, yeah. So
Yeah.
you're testing for the lipoproteins and things like that as well.
Yeah.
Very good. And so your consultation, your labs, and then you start with the detox and the trying to
I
reduce
do encourage
inflammation.
some baseline imaging too, because we don't know what we don't know, right? So I like a
Right.
carotid ultrasound.
Okay.
There's a company, anybody can go do this, Lifeline, all over the country. Usually it's like $200. They'll give you carotid ultrasound, heart ultrasound, EKG, and then I'm really encouraging everyone I work with, if they're up to it, then we do a clearly AI imaging, right? Which uses CT and contrast, and then we can see every artery on the heart. And not only
It's
that,
awesome.
how much plaque is in each artery and what kind of plaque is it, right? Because different plaque
Uh-huh.
behaves differently, and then we really know what we're working with. Why is this good? Well, sometimes like we need to light a fire under our butt so we get moving, right? I mean, I know I need that, right?
Right. That kind of test result, you'd be like, oh my gosh, what have I been doing to myself?
It off, but then also it works the other way because I had a client that just did it and she was worried, but she tends to run a little neurotic, you know?
Yeah.
Um, but all the stuff happened. Like her mom died, her dad died, her dog died. It was crazy. And I said,
Um,
Let's reset you and then let's do the good imaging." And she was less than 1% plaque. And so then
wow.
it's like, you know.
Yeah. So if someone wanted to get started with you and do some of that testing, one of the first things you would recommend is the carotid artery ultrasound, because that's a really good artery to look at for just to tell you if you have plaque buildup at all.
A lot of people,
Correct?
a lot of people do tend to stack plaque there. That's one of
Okay.
it's either there or the heart, or some people get both, you know.
So, the, let's move on to glucose and insulin regulation.
Yeah. So if you're a human that eats food, you need to care about this, right? Because this is the part that was missing from the driver's manual of the human body. I know we all lived through that like fat fear of the 80s and 90s, right? I mean, I was sure that if I ate butter, I was going to die of a heart attack for years. And what happened when we were all afraid of fat is that we all got fat and diabetic, you know. So there was a lot of misinformation, and people, you know, are well-meaning, but like if you're given the wrong map, you're not going to get to the right place.
Right. So tell us the relationship between a high fasting insulin or elevated blood glucose and the connection to that with heart disease.
Yeah, so it's probably the most important thing, and even with high blood pressure too, is the insulin. And we're basically pretty much everyone is insulin resistant. We're running on stress or high cortisol. That's going to pump up the
Uh-huh.
glucose. We've been given bad diet advice, you know, that we think is good, and then the glucose goes up, and then the insulin follows, right? Because the body wants
Right.
glucose in balance. But what does insulin do? It makes us store fat. So if you're getting a belly, you're getting chubby, and then we know that's not good for our cardiac health, right? But that's
Right.
insulin does. It's going to cause inflammation. So we can see how that could cause high blood pressure and cardiovascular damage, right? It's going to do fluid retention, right? Which is going
Mm.
to raise the blood pressure and cause vascular damage. So it does all of these things. It's also going to interrupt sleep. Poor sleep causes oxidative damage, damages the blood vessels, right? So
Right.
a key component, and even if you're not working on cardiac, if you're working on anything, you need to work on the insulin and the glucose, or you're not gonna make the distance.
So a good fasting insulin, and people need to have fasted at least 12 to 18 hours, correct? Maybe
I
even
think
24 hours.
no, I think 12 hours is fine.
12 hours is fine.
Yeah.
Um, I've read that a fasting insulin of 4 or 5 is ideal. Do you
Less than
agree?
5. Yeah.
Less than 5.
And just ask for it, because people like get told no all the time, and that their insurance doesn't cover it. But I think it's like $20, and it's going to give
Yeah.
a lot of. And just ask for it. Like you're worth the $20. Like figure out what the heck is going on under your butt. And then the thing is, your lab sheet will say that you're fine with an insulin of 20.
Right. You're
Don't.
within range, but right.
Yeah,
We've started doing that in our clinics, almost across the board.
that's
Almost
good.
across.
That,
Yeah.
that that's what I want to see. I want to see everybody doing fasting insulin on screening labs, because it's safe.
Yes.
Really?
Yeah.
And then
So,
that imaging of the heart, right? Because
right,
everybody gets the colonoscopy or the Cologuard at 50, right? Like maybe kicking and screaming, but we do it. And then
right.
heart disease is 17 times more common than colon cancer. So I think in 10 years, everybody's going to be doing this clearly imaging too. But I just think that medicine's slow.
Yeah. And for all the listeners, all of these details will be in the show notes. So you can reach out to Dr. Melanie Icard. And also you can reference all these things she's mentioning, even if, you can take it to your own physician. So let's move on to calcium. You mentioned you treat with some calcium.
Yes. Yeah, so people go and get those calcium scores and it's like the worst. I have some colleagues that are very anti-calcium scores because they feel like it's just radiation and fear mongering and it's a waste of time. So basically the calcium should be, they say 0 to 10 is normal. I talk to people every day that are like 2,000, 3,000. So like don't freak out if that's you.
Uh,
You're not a complete freak of nature, don't worry. Um it means that you've had plaque and now it's stabilized, right? Well,
uh-huh.
you still have plaque because it's a soft plaque that's dangerous, right? And that's why the calcium score doesn't really help us with that. And then here's the other thing. In modern days, we get a lot of pollution of aluminum, and that can displace our calcium as well, right? So we've got to be on top
Right.
of detoxing these metals all the time because that's pushing your calcium out of where it should be and into the wrong places. So I have 3 therapies that I do for that. Well, maybe 4, right? The main one is anti-orbital ionic calcium. This is
Okay.
amazing. This is not a calcium supplement. I'm not a fan of calcium supplements personally.
Okay.
They tend to gunk up, and calcium's already gunked up.
Uh-huh.
So basically, this is a home therapy. People do it as IV and breathing treatments. I've just found you can do it at home orally, and it works amazing. And you take it, and it goes in and it scoops up rogue calcium that's out of place and puts it back into the bones and the teeth, so it can recreate calcium
Nice.
homeostasis, right? So it can reverse osteopenia, osteoporosis. It's anti-cancer. I actually heard about it at a natural cancer seminar I like to go to. So, it's great, but it's great. Obviously, we get calcium in the arteries and in heart disease and high blood pressure, but also the arrhythmias. That's just calcium missignaling, right? Or even pain syndromes. That's like they're sending that calcium like you're in pain, you're in pain, you're in pain.
Right.
Calcium adhesions in the joints. So all this stuff you can see get better. People with arthritis and gout, they feel better like in the first,
Mm-hmm.
you know, you can't feel your calcium score going down or your bone density getting better. You have to do imaging later for that, but like it is efficient. But the people that have arthritis and gout, they love it because they feel better it like pretty much immediately. So
Interesting.
yeah.
And you mentioned aluminum.
Mhm.
So do you do heavy metal testing?
I
Is
don't
that
even
part of
do,
your protocol?
I don't even
You
do
know,
heavy metal testing because I know you're getting it all the time every day. So I just
yeah.
be on gentle chelators. I do one
Okay.
zeolite and then I do boron. Boron is really great at like instantly bringing down the aluminum level. If you live somewhere where they do a lot of the chemtrails, you need to be on boron.
Okay.
Mhm.
Interesting. You're just full of good tidbits.
The other thing that we do is we encourage everyone, and if they're in our platinum program, we just send it to them, but we encourage everyone to get a far infrared sauna. Amazing at
Huh.
pushing metals and the microplastics. And we all need that.
Right, right. Do you have a red light sauna you recommend?
It's a far infrared sauna, so it's invisible to us, so it feels just like heat. And I like the
Okay.
relaxed saunas. It's so funny because they would be at every like seminar I would go to, and I was just like,
Uh-huh.
I'm not interested in their sauna. And then finally we were at a seminar and they were there, but then a colleague presented information about how he tested his urine and sweat for aluminum and then tested it again on high chemtrail days. And
Uh,
it was like 200 times higher, like just from heavy
interesting.
chemtrails. And
Yeah.
then we don't have to freak out because then he would get in the sauna and go back to baseline. And so
Okay.
then
Wow.
that's when they finally got me. It was like, I was playing hard to get for like 10 years.
Yeah. Well, they just had to prove it to you for sure. And then you mentioned the IVs.
Oh yeah. So
That
the IVs help too with the calcium and the Plaque X has been documented, the Plaque X IV to help with the calcium, but I really think it's the synergy because I do ozone with UV light with the Plaque X, but also with all that baseline stuff with the insulin, with the disinflammation, and then after that, I do have all my clients do a gut too, because believe it or not, everybody's gut is inflamed and that's
uh-huh.
leaking out into the system and actually causing high blood pressure and systemic
Right.
inflammation as well. So we've got to get on top of that too.
So interesting. You mentioned ozone.
So ozone is 3 oxygen molecules, and it's literally my favorite therapy. Like, whenever I sit down to do an IV, 10 times out of 10, it's always ozone because it's the best for
Uh-huh.
everything, right? It's anti-inflammatory. It increases oxygen utilization, therefore it's anti-aging, right? It makes
Uh-huh.
energy pathways work better. It helps detox you. It's antimicrobial. You full of candida or who knows what, it's going to help you with that. I've even used it
Right.
in like walking pneumonia. I mean, it's just such a slam dunk for everything. It's just such a blessing. And everyone needs that. Everyone's blood's a little bit thicker since COVID. Everyone's inflamed. And that's why I used to just do ozone. And now I do ozone with the UV light. So then the UV light is kind of like doing the same things as ozone, but in a different way. So then it's double anti-inflammatory. It's double oxygenation, it's
Wow.
double balancing the immune system.
So if someone is going to do a virtual consultation with you, walk us through how you would help them, what that would look like.
Yeah. So the people that we work with virtually, we do the same thing with the people, we call it hybrid, because most people come from other states and they come here just to do the IV section
Uh-huh.
of the work. So, we'll get those holistic labs to you. We'll get whatever imaging needs ordered, right? And then I personally, or the nurse practitioner, will work your case over with you, and we'll work with you multiple times. You'll have a personal health coach because life is busy and we get distracted. So it's almost to just help you stay on track, because you have to move through these processes to get the results. And we send
Right.
you everything you need to get the results, like all the calcium balancing therapy, the herbal detox, the boron, everything you need to get where we want you to go. And then we do live calls, right? I just did a live call this morning. So Mondays is more educational and staying on the protocol. And then Wednesdays, we do nervous system reset, right? Because it's so important that we work on that relaxation muscle, because we are all mostly American and we have much hustle in our culture,
Right. Right.
So
So
we try to work on that.
that brings up something I wanted to ask you about. You have tell us about what you do in Sedona, the workshops you do.
Yeah. So Sedona, we do an immersion, right? Because a lot of people, we feel like we're too busy to do an extended program, right? Or we know we're going to get distracted. So this is so that you get an immersion, so you can't get distracted because you're there. You're experiencing everything, You don't have to wonder what to eat because we're going to feed you what you should be
Uh-huh.
eating, and it's going to be
Uh-huh.
delicious. You don't have to worry about figuring out how to balance your glucose, because we're all going to do it together in real time. So you go home knowing how to work that system. We're going to start the detox together. You're going to get to experience those nervous system resets, right? And also experience like just unplugging and letting someone be in control for 4 days, right? So you don't have
Right.
to, because even just that, if we did nothing, would be healing for pretty much everybody.
My goodness, that sounds like heaven on earth.
Yeah, we all need
That's
it.
yeah. So, and you can sign up for your Sedona retreats through your website. And I think you said both of the ones you have coming up are full, or they're
I
you're
have I have 2 spots left, but it's coming up really quick. It's May 15th to the 18th, and then we're
okay.
going to come back in October, the
Perfect.
23rd to the 26th. So we'll kind of skip the heat.
Yeah, that hot summer. Uh, I'm looking here at your website, and under our philosophy, I just want to read this. It says symptoms are messengers, not enemies. The body isn't broken, it's communicating. Given the right conditions, the body repairs itself naturally. We don't force healing, we remove what's in the way. We don't set goals, we raise standards. Less fear, less overwhelm, more strength, more life. Release survival, embrace thriving. Welcome to the work. I just think that's awesome. So you can find Dr. Melanie at drmelanieicard.com. And you have just been a pleasure, and I've learned so much. I know the listeners have too. But Dr. Melanie, is there anything you'd like to leave us with? Anything we haven't touched on?
No, just reinforcing that the body is amazing. And like, people even grow extra arteries when your heart arteries are getting full of plaque, you will grow an extra artery. And that's without even trying. So just imagine if you did try and you made that environment, of course your body can heal itself. So have hope.
Yes, that's wonderful. Well, thank you for your time today, and we will let you get back to your patients.
Thank you.
Thanks, Melanie.
Thanks for listening to Hormone Heroes. Take a moment to subscribe wherever you listen to podcasts so you don't miss the next episode. While you are there, help us spread the word by leaving a rating and a review. If you would like to share your bioidentical hormone story or need help finding a physician in your area, please email us at drkelly@hormoneheroes.org. That's DRKELLY at HORMONEHEROES.org. We want you to be a hormone hero.